Next slide. So just to kind of start with the basics, which many of you probably already know, autism is a neurodevelopmental condition that typically appears in childhood, may not be diagnosed right away, and has a variable severity and lots of a wide variety of symptoms sometimes. The symptoms, though, fall in two categories, difficulties with social communication and interaction, and then the other group is more restricted repetitive behaviors and interests. All right, next slide. So this is a busy slide, but it's just the purpose of it is to show you that autism actually has a lot of other things associated with it. Those dark blue circles are the core symptoms, but you can see that there's a lot of other things that can go along with autism: mood, anxiety issues, ADHD features, sleep problems, seizures, some physical issues, all kinds of other things can also be associated with autism besides those core symptoms. The other piece to note is that some of those associated conditions, sleep issues, anxiety, for instance, are things that other people can have who don't have autism. So sometimes people will say, well, I've got something similar, but they're talking about some of these associated things, not the core symptoms with autism. So it can get pretty complicated and complex at times. Next slide. From a medical perspective, there are several different types of providers that might be on your child's care team. Now, I'm going to say for a moment, I'm a developmental pediatrician, so I'm in that middle category. So I will often talk about from the perspective of, say, things of pediatrics. So talk about your child. I know very well that children with autism become adults with autism. So I don't mean to slight the adults at all, but I just kind of come at it from this perspective. I will tell you when there are differences between the child and the adult piece of this. And one of the first differences is developmental pediatrician, because there is not an adult comparative specialty. But the general providers on a care team would, from a medical perspective, would be a primary care provider, if it's a child, a developmental pediatrician, and then specialty providers. So next slide. So primary care providers are sometimes referred to as PCPs. In medicine, we like our initials sometimes. And those are physicians or nurse practitioners, physician assistants. Physicians fall under the category of a medical doctor, an MD, or a DO, a doctor of osteopathic medicine. Both of those groups have been to medical school. Their training varies a little bit, but they're both known as physicians. And whether your PCP specializes in children or adults or both is where you see some of these other labels. So, for instance, if your PCP specializes in children, that's a pediatrician or pediatric provider. Internal medicine, they just focus on adults. And then family medicine can do a little bit of both. They'll see kids and adults. And the focus for primary care providers, for PCPs, is broad. It's well care, immunizations. These are the folks that you'd see for sick visits, like when you or your child has the flu. But they'll also see kids for chronic conditions as well, like asthma or diabetes, and they can do some care for autism also. So next slide. I am a developmental pediatrician, as I mentioned, and that's a specially trained pediatrician. I've had pediatric training and then additional training to look at developmental and behavioral concerns. Next. And developmental pediatricians diagnose and treat children with developmental disorders such as autism. And we will assess development, make diagnoses, and help families come up with treatment plans. We are often one of the first professionals that make the diagnosis of autism. And also we monitor progress kind of helping families develop a good treatment plan and figure out if there's other providers and who they need to see. Next slide. As I mentioned, we will do diagnosis, and that usually consists of a parent interview, behavioral observations, and then some testing. We'll also make recommendations about what kind of therapies would benefit your child, and then follow kids over time. This is the fun part, really, to be able to see progress, adjust the care plan as the child grows, because from the time of diagnosis to, adolescence and beyond, there's a lot of changes that happen. And that's what we're helping to track the milestones and address emerging issues. Next. All right. Your developmental pediatrician can also offer guidance on managing behavior, communication, and social skills needs. And then also we collaborate with other healthcare providers and other therapists as needed so that we can kind of provide that comprehensive approach. Next. This slide just represents that we are looking at sort of the whole picture, not just focusing on a narrow part of autism, because autism is affected by and affects a lot of other things, and so we take this view in pediatrics and in medicine in general of this it's called a review of systems. So sort of looking head to toe look at what's going on. And that can be looking at behavior, but it also may be asking about sleep and eating and then physical symptoms, because we know that kids with autism and in adults also, if they're not feeling well, that affects a lot of things. It affects their learning, it affects behavior. But sometimes if they've got an ear infection or difficulty with constipation or stomach pain, they may not be able to describe it very well. So your medical provider will probably be asking about these other things, and you may think, well, this isn't related to the autism, but it can really have an impact. So that's why we're looking at that whole picture. Next. These are some of the specialists, and I'm going to touch on them briefly. You'll get some more information in the materials that you're going to be sent about them, but these are some of the more common specialties that individuals with autism may see. So next. Neurologists specialize in the brain or the nervous system. And for children with autism, they may be seeing kids because of seizures, other neurological conditions. Seizures are more common in individuals with autism. So if there's concern about if there's concern about unusual movements or staring episodes, and that's something that you're worried about the possibility of seizures, we would always encourage to talk with your primary care provider, who may do some testing, but also may refer to neurology to help figure out what's going on. Next slide. Sleep is a common issue for a lot of individuals with autism, so it can be helpful to see a sleep medicine specialist. Kids with autism may have trouble falling asleep, staying asleep, or just have a really unusual, erratic sleep pattern. Primary care providers may offer some of the first guidance and treatment for sleep problems, but then may refer to sleep medicine if there's concern for other issues such as sleep apnea, or if some of the things that your primary care provider has suggested haven't worked. So next slide. Gastroenterologists or GI doctors specialize in the digestive system. Individuals with autism can have some GI issues, especially constipation, sometimes diarrhea, or food sensitivities. Again, these may be things that your primary care provider can manage, but they may refer to a gastroenterologist if what they're suggesting hasn't been working, or if they're concerned about something that needs a little bit more evaluation. So that is a GI doctor may be somebody that you get a referral to. So next. ENT, ear, nose, and throat specialists, are also called otolaryngologists. We almost always just call them ENT. And they treat and diagnose and treat disorders related to the ear, nose, and throat. And for kids with autism, that may be looking at the cause for ear infections, maybe looking at swallowing or some kind of oral motor problem, but it also can be checking hearing because that's one of the concerns that we always worry about. I just saw a kid this afternoon that I sent to ENT to make sure that they were hearing okay. So that's a very common referral and that your primary care provider might make. Next. Geneticists focus on genetic conditions, and there are lots and lots of genetic conditions that can be related to autism. And the geneticists are the ones who can order the right tests and then also interpret them, which is really important. And we do generally recommend that individuals with autism check their genetics, see if there's an underlying genetic cause that may help guide what kind of treatments your child or your adult needs, but also may point in the direction of some other medical things to check out. So a geneticist can be really helpful. Again, I made a genetics referral for a kiddo this afternoon, so it's a pretty common referral that your primary care or developmental pediatrician might make. All right, next. And I think I'm passing it off to the next person.
Yeah, I'll go ahead. So hi everyone. We're now going to talk about some of the other providers that you might see on your child or your adult's care team, specifically related to psychology, allied health, and then also social work. You can go ahead and next slide. So first, I'm going to talk about psychologists. And right now, when I'm talking about psychologists, I'm specifically talking about psychologists that you might see in like a medical office or at a private practice. These are usually thought of as kind of different from school psychologists. However, we do a lot of the same things, but that's who I'm talking about today. So a psychologist like myself has a doctorate degree, so PhD or PsyD, and they specifically specialize in both diagnosing and as well as treatment and intervention for mental health conditions or a lot of these like neurodevelopmental disorders, things like autism that we're here talking about. Next slide. So, specifically, what psychologists do, we do quite a few different things. A lot of you might have seen a psychologist as a part of the team when it came to diagnosing your child, but also psychologists are really involved in the treatment of mental health and behavioral concerns. So, things related to counseling around emotional regulation, or maybe co-occurring disorders like ADHD, anxiety, depression. And then they also can help with consultation. So, consulting with other maybe school, medical providers, things like that. There is a wide range of things that psychologists can do. What the important thing is to know is that what psychologists can help you and your child with is that we specifically will focus on things like coping strategies for things like, again, those mood disorders, so maybe anxiety, depression, as well as maybe some of the emotional challenges or regulation difficulties that you can sometimes see in autism. Again, psychologists are also really critical in that part of our job and our training is also in understanding how learning works. And learning is important because learning is not only present at school, it's also part of how we learn coping skills, daily living skills, life skills. Also, really importantly, things like leisure skills, having fun, which can be something that we find that we focus on things like in transition or adulthood. And psychologists can also better help and have training on working with families. So, helping families maybe understand how autism or just other characteristics of their child impact their family and how to maybe just manage family dynamics as well. Next slide. So, when we're talking about psychologists, one of the things that they can do, like I mentioned, is kind of that initial diagnostic evaluation. Sometimes this might be for autism, a lot of time it is, but also psychologists you might see for things like looking at a learning disability or maybe intellectual disability or intellectual developmental disorder. The whole purpose of an evaluation is to kind of get to the outcome of figuring out what's important for treatment, what can be important for things related to different types of intervention or services. And really, hopefully, just for sharing and giving more information about how your child is learning and understanding the world. What diagnostic evaluations look like usually includes interviews with caregivers or the participant, either the child or the adult, standardized tests, observations, and behavior rating scales. All right, go ahead to the next one. The other role that psychologists can play is in treatment or intervention. And this can kind of look different. Some psychologists, and it really, part of the reason why it looks different is it's based on what's helpful and what's needed for the child or for the family. Sometimes the psychologist might specifically work with parents or caregivers, especially if I'm thinking about maybe a 2 or 3 year old child. I'm not going to see them for counseling. I'm going to work with a parent or the family on different behavioral strategies or other things that they might do. However, sometimes psychologists might work one on one with a child or might work kind of for a whole family. And the whole goal of treatment, well, it might again is always going to look specific to the child. Usually it's mostly focused on kind of increasing safe behaviors, teaching social skills or life skills, and also teaching skills that enhance the quality of life for you and your kid. All right, go on next. Consultation. So, this is another thing that psychologists can do. And this is actually something that's part of my job too. So, this is kind of providing advice to other people who are working with you and your child and other professionals. Psychologists can consult in schools and hospitals or with other community providers. So, for example, I provide consultations for kids with autism or other intellectual disabilities who are inpatient for other medical conditions. So this week, I was providing consultation for a 7 year old who had autism and also had a new cancer diagnosis. And I was working with the family and with their team on how was the best way to kind of developmentally explain cancer and chemotherapy to this child, and also helping the team with some different kind of sensory friendly ways that we can adapt their treatment or talk about their treatment for like getting chemotherapy or a port placed. I'm not going to see the family for ongoing treatment. So this was something that was really short term and targeted and was a type of consultation that I provided as a psychologist. All right, go on to the next. And then this slide says allied health providers, but I also saw in the chat someone asked about a neuropsychologist. Neuropsychologists, I'm just going to say pretty briefly, can also focus a lot on the testing portion that psychologists do, but specifically usually provide testing related to different medical conditions. So maybe you might provide testing prior to something like a brain surgery or something like that, and don't always provide as much kind of like that one-on-one treatment, but definitely will do things like diagnostic evaluations and consultations as well. That was a really brief one, and we'll probably send some more information in the chat about that. The other thing that I'm going to talk about is allied health providers. This is kind of a fancy way of just saying these are other healthcare professionals that are usually going to be working with your family on specific kind of therapy goals or things like that. In particular, we're going to be talking about speech language pathologists, which I think a lot of you have probably seen or worked with, occupational therapists, and physical therapists. Next slide. So, allied health, again, these are healthcare professionals. They're not doctor or a nurse, and they're not a pharmacist or a psychologist, but they are focused on a specific area like speech or communication or feeding, fine motor movements, gross motor movements. And what's important for you to know is that they're really helpful, especially when it comes to therapeutic support. And they also work as a part of kind of a comprehensive care team. And you might see different ones in school or in private practice. So you might actually have more than one of these people. And next. So one of these really important professionals is a speech language pathologist, or usually you'll hear people call them an SLP. What they do, what the process looks like, they'll always do some type of an evaluation, but they're typically not the people, or in most states, they're not the people that diagnose autism, but they're probably going to do some type of evaluation related to communication. And the purpose of that is so that they can get information that can be used in treatment. The goal of a speech language pathologist is always going to be kind of to give you information about treatment or an intervention. Those interventions can look different. Sometimes they focus on things like feeding or swallowing. Sometimes they focus on making sounds, speech production. Sometimes they also focus on things like just language in general, especially things like AAC use or kind of devices or PECs, picture cards, things like that. And speech pathologists can be at home, they can be in a clinic, a school, or a hospital. Next slide. Occupational therapists or OTs. These are another type of allied health provider, probably a lot of you have worked with or heard of. Similar to a speech language pathologist, they're not going to be the ones diagnosing specifically autism, but they are going to do an evaluation so that they can learn more about your child and also identify specific targets. Targets, kind of the fancy word for treatment or for skills for treatment. OTs can work on different things. They work on sometimes like fine motor skills, so strengthening, self-care skills, brushing your teeth, tying your shoelaces, but also they focus on things like emotional regulation and sensory processing too. And similar to speech language pathologists, they can work at home, clinics, school, or hospitals, kind of across a wide range of different centers. And next. All right, and now I'm going to turn it over to Sabrina to talk more about social work.
Hannah. So I want to talk a little bit about social work and the role of social workers and the with families. So social workers focus on helping families navigate the complexities of healthcare systems, schools, and help with community resources. For children with autism, they can provide emotional support to both the child and the family and advocate for the child's needs in educational or healthcare setting. I wanted to add a note here about this because I feel like I'm using this as kind of a broader title because there are so many different roles and disciplines. So oftentimes, counselors are doing very similar work or family therapists. You may have someone that is a case manager or service coordinator who is trained as a social worker, but that's the role that they're playing with your family. Next slide. So what they do, like I said, they help navigate healthcare systems, schools, and community resources. They provide emotional support to the child and family and advocate for the child's needs in those settings. Something that parents should know is that social workers are valuable in helping families manage stress and cope with the emotional demands of caring for a child with autism. Excuse me, so that can be connecting families to resources such as financial support, special education services, or other therapy programs. Social workers may also offer family therapy and support in building social skills for the child with autism. They work with other healthcare professionals to ensure that there is a strong support system and advocate for the child's rights for services. Next slide. So just a few things that we as social workers can do. Social workers are able to provide direct treatment to a child with autism, so doing individual social skills therapy, group therapy. And they are also able to work with the family system. So they may do some family therapy and also working with only the parents to do some parent training or consult services. As I said before, case management, a lot of times, if you have um, a board of developmental disabilities or a department of developmental disabilities, you're assigned a case manager, and they are someone that helps to make sure that you have all the resources connected for the child. Also do a consultation. My role here, I am doing assessments with families, so initial assessments, and then referring on to ongoing treatment or additional evaluation. So we're not able to make diagnoses, but able to kind of start that process for families and connect with services. We do lots of referrals for outside services, lots of connecting with other services, and lots of just supporting families and walking through this whole process with them. And
Sabrina, before I dive into my next slide here, I wonder if I can just ask you a question from the chat. Can you tell us
yeah,
a little bit about some of the ways that people might be connected with a social worker? How do people find a social worker?
yeah. So oftentimes, if you are connected with a medical clinic, there's a social worker there. So if you have a specialty clinic, there may be a medical social worker that can help. The medical social workers typically do a little bit more um, resource management support in that way. If you are in a bigger kind of system and there's a behavioral health program, then that's how you may be connected with the social worker. And then again, through other agencies, their County Board of Developmental Disabilities, Department of Developmental Disabilities, is often social workers as well.
Thank you. That's great. And I think that might be your last
Yeah.
slide. I think we'll go to the next slide, and I think I'll jump in here. Thank you guys for continuing to drop questions in the chat. We're happy to try to answer those as we go. For this next chunk here, I'm going to talk with you a little bit about multidisciplinary care. You have just heard about many of the different professionals that you might interact with, but we want to think about what multidisciplinary care is and what it might look like for your child, because it really does look different in every situation. We hear this terminology a lot. It can mean different things within different organizations and clinics or hospitals. So don't be confused if you hear people use the terminology in different ways. But in general, a multidisciplinary care team is a group of healthcare professionals, the folks that you just heard about, who work together to provide high quality and coordinated care for patients. Your child and you as parents are really at the center of any multidisciplinary care team. And this is because you and your child are really the only constants in that care team. As other people come and go throughout your child's life, you and your child should remain at the center of care for your child's lifetime. Let's go ahead and move to the next slide. All right, so in autism care, who do we think of as the most common players on the multidisciplinary care team? Well, really all the folks you just heard about and learned about from Karen and Hannah and Sabrina. But these are going to include a lot of different professionals like medical doctors, like developmental pediatricians, neurologists, gastroenterologists, other mental and behavioral health providers like psychologists, psychiatrists, social workers, behavioral therapists, those allied health professionals like your speech therapist, occupational therapist, and of course your school team. So those are all the players that you're seeing here that could be part of your child's multidisciplinary care team at any point in time. And we're going to talk in just a minute about how that might change over time. But let's go ahead to the next slide. A couple of things to keep in mind when you're thinking about multidisciplinary care for your child. We really want to make sure that your care team is guided by the needs of your child and should evolve based on your child's changing needs. So there will be multiple providers in your child's life, sometimes all together at one time, and sometimes just one or two at a time. Remember, don't compare your journey to other people, as different clinics and hospitals have different models of care. For example, at my clinic at the Lurie Center, your child might be diagnosed with an evaluation with just one provider, like a psychologist or a developmental pediatrician. And at some other clinics, you might see multiple disciplines or multiple providers at the time of your child's diagnosis. Neither one is right or wrong, right? We can talk about the benefits or advantages and disadvantages of each of those models, but don't worry if you're not experiencing the exact same team or journey as someone else that you talk to or see online. Also, some people need the support of, for example, a private outpatient speech therapist, and other people do really well with just speech therapy at school. So again, you don't have to have every single player on your team. You might not have those allied health professionals if your child's doing well with their school-based speech therapy or occupational therapy alone. Or you might need those allied health professionals to pop in or to provide treatment around particular issues at a certain point in time. So what does this really look like? Let's take a look at a few examples as you go through your journey. Let's pop on to the next slide. Okay, so we've got on the left-hand side of your screen that full makeup of all the professionals that could be part of your multidisciplinary care team. But what does that circle look like at age 2? You might have a much smaller circle of care team members. You might just have a few folks like your ABA team, a speech therapist, and your developmental pediatrician, right? With your PCP at the center of that team, helping you manage some of the questions that you might have around nutrition or sleep or immunizations, right? So that smaller circle at age 2 might include only a couple of people from that broader list of providers that we've learned about today. Next slide. Now, how about 30 years later at age 32? Later in this journey, you're still going to likely have a smaller circle or subset of providers involved in your child's care, but it's likely going to look very different. So at this point, you may have discontinued or sort of outgrown some services like ABA. But you may have added in support from other professionals like neurology for managing seizures or psychiatry for managing co-occurring anxiety or behavioral challenges that may have increased as your child's gotten older. All the while, you and your primary care provider should remain at the center of your care. I also just want to pause. We had a really good question or sort of comment on the challenge about finding developmental pediatricians, and Karen may have comments to share later. But I do want to just touch on this because it's really important to recognize that the professionals we've talked about today have overlapping skill sets in many, many places. And so, unfortunately, there are not enough developmental pediatricians in the United States for every person with autism to be sort of followed or cared for by one of those people. But the good news is that other people, sometimes child neurologists or psychiatrists, sometimes psychologists, also share a fair amount of expertise with our developmental pediatrician colleagues around development and interventions and supports that your child might need. So if you are in an area that is a sort of developmental pediatrician desert, please think about what your child's needs are and consider that another professional, someone with a different title or degree, might actually be able to provide what you need in terms of monitoring your child's development and guiding their autism-related care. Karen, please feel free to jump into the chat if you have other thoughts there, but let's go ahead and cruise on to the next slide. I think I have just a couple more slides here. Let's see, I think we maybe went 2 ahead. Can we go back 1 and see if there's one there? Oh, no. Okay, we're going to skip. All right. So the last thing I want to cover is really important topic, something that I'm really passionate about. Today, we talked about a lot of the specialized care needs that your child with autism may need. And yes, it's true that your child with autism will very likely require specialized autism-focused care and support throughout their lifetime. But they also need and deserve ongoing preventative well care too, just like you and I. Your child will need regular lab work and dental cleanings. And when they get to be my age, the dreaded colonoscopy. You're going to hear in a little bit today about how we can support successful clinic visits. And I want to make sure that if I can inspire you to take one action step after our session today, I want you to think about how you're preparing your child today for the preventative well care that they might need throughout the course of their life. I really encourage you to work with your school team or behavioral therapists to start now, especially if your child's young, although it's never too late, to build your child's ability to tolerate and participate in medical procedures even before you need those procedures done. I don't want you to get caught off guard or denied appropriate care. I want you to be prepared for providers that might say to you, I don't treat autism, right? And your response may be, I'm not asking you to treat my child's autism. I'm asking you to treat whatever medical condition you're concerned about for your child. So all of your loved ones deserve really good preventative and ongoing well care. And now's the time to start to think about preparing for that. So I think from here, I'll pass it to Amy.
All right. Thank you, Lisa. Okay, Kyle, go ahead and go to the next slide. There is a question in the chat on if somebody wants to grab that. I'm going to continue on. So we're going to talk just about the successful clinic visits. And I know this is probably a topic that you've probably had some information on before in the past, but what I want to do is talk a little bit about from your perspective as maybe the adult going in with your child or young adult. And then I'll talk about from the patient perspective, if you will. So successful clinic visits. I think one of the things I like to say, and I really believe, in my life and my journey with Henry, is that, your voice on care teams is super powerful, right? I mean, I always say I have an MD, PhD, and Henry Hess. Like I've known him since birth, right? So I've known him the longest. I feel like I've got a lot of information to share. So you're an equal partner at that table when you go into clinic visits, and always remember that. I think, some of the things to think about is that when you go into clinic visits, I know that a lot of times in the younger years when Henry was younger, I would focus on getting through that visit rather than really looking at, are we building, skills to take into adulthood? And that was shots were always tough, right? Pill taking was tough in the beginning. Getting blood pressure, getting blood draw, super hard to do when he was little. And actually, we didn't even achieve them many times. But we want to think about those skills and, are we building those skills so that we can ease them out of those pediatric years into adult care? And what I like to say is care anywhere. My hope is that Henry can get care anywhere, not just in a specific clinic with a specific person. I think the other thing too is that, and I've learned this from a lot of the professionals that you've heard today, is that, adults with autism, kids with autism deserve high quality care. And we shouldn't, fear it or put a barrier up or not seek it because of the fear of not being able to do the blood draw that's associated with it. So, those are things to think about. Again, like as you're doing clinic visits, do the most successful point that you can so that you can, again, achieve a step here as you move towards successfully mastering things. For example, I did a lot of different blood draws with Henry. None of them were successful until just a couple years ago. So it took a really long time to get there, but we got there. And I think that's something that I've learned is that it may not happen the first time, the second time, the eighth time, the 10th time, but if it happens on that 11th and 12th, then we're in that category of care for life. I did the same thing with braces. It was a small step to how do we actually get them on, and then how do we get them off. The other thing too is that I always like to talk about those successful visits and ongoing care in the sense that, again, you want to talk about what accommodations are needed so that you can access really good care. And again, that's where your voice in clinic visits is really important. And again, lifelong care, I can't say it enough. Care anywhere is my goal to achieve for Henry so that he can get, a shot if he needs one. If he's, if we're out of town, whatever it might be, I want him to be able to access that. So something to think about as you're going into clinic visits. All right, next slide. The other thing too is that, like I've said, you're central in this role. You are the primary advocate for the young adult in your life, potentially child in your life. And you have a really deep-seated knowledge of that individual. So that does kind of make you a care team leader. And it's a role that I felt like I got when Henry got his diagnosis. It was the role that I got. And I didn't know it at the time, but it's something that I came to know. But you're going to meet with a lot of the professionals we talked about today, doctors, therapists, educators, psychologists, and you're typically going to be the person who's going to communicate everything to all of those people. You're that central role. And if you think back to that slide I showed earlier where the family's in the middle, and like on Lisa's slide, even all those multidisciplinary individuals that might be part of your child's life, you are that central person who is probably going to be the main communicator. So think about that as you go into care meetings and what kind of information should you bring into that. All right, next slide. So some of the things that I kind of think about, and I'm hoping to maybe share with you today, is that, I always try to get prepared before I go into, clinic visits. I bring in notes, I bring in maybe, video, I bring in photos, I bring in charts, whatever I might have on hand. But I go in with a focus on what do I need to talk about, and then I never hesitate to ask questions because even if it seems like it's the smallest question, it might be something that's really important. So I think as you build your confidence in being a care team leader, think about how are you preparing and walking into these clinic appointments. I think the other thing I've learned, and again from a lot of the professionals you've heard today, is to build a partnership. It's not what we do with or not or to or for. It's what we do with the professionals in our lives that are going to make successful clinic visits. So think about what is that partnership going to look like, and how can you build that trusting relationship. The other thing I too always say too is that if you're working with an individual, and I've had for example, speech therapy in my life where it hasn't been like a really good match, it's okay. You can go ahead and look for another person in that discipline to maybe work with who is a better match and a better fit with your family. So again, build those relationships. And again, I think, I can't say this enough, collect information that you feel like is really important before you go into a visit. what are you seeing at school? What are you hearing from school? What are you seeing at home? What are you identifying? Is sleep a really big issue? Track it so that you can bring that in, because all of that documentation that you share will help to inform that clinic appointment and hopefully take the most effective step next. All right, next slide. So again, I think motto for this is be prepared, focus on what is the primary thing that you want to talk about in clinic appointments, be collaborative and bring in a lot of information so that you can really have that conversation, and bring in information that you're hearing from other parts of the child's life so that they have a really full, robust picture of what's going on. All right, next slide. So now I'm going to talk about a successful clinic visit from Henry's perspective. One of the things that we do is we always prepare ahead of time. We talk about it. I'll bring up pictures if we've been to the clinic before, those kinds of things. In the past, when he's not been familiar with an office, we've driven by it. We've actually gone in to visit it. But again, I think making sure he's, a very aware of what we're going to be doing that day and where we're going to go is really important. The other thing too, and this is I think you probably all do this, pick the right time. I will never do a morning appointment because he is not a morning person. It's always going to be in the afternoon. So think about what's the best time. Where are they going to be at their optimum self? Do they know where they're going? Have you already addressed any anxiety that might be around that? And how do you prepare for them? So planning is very important. Next slide. I think the other thing too is I get him really prepped, right? I make sure we have, his phone or iPad, so he's got something to do while we're there. I address his sensory issues, like does he need to have sunglasses because sometimes it's super bright in clinic appointments? Does he need to? One of the things I've always taken with me is this little thing called a shot blocker that you can put on your arm. So if he's going to get a vaccination, we put it on. It kind of desensitizes your skin a little bit, and then we do the shot. The other technique I've always done is that we do a fake shot and then we do the real shot. That way he always knows he's going to get 2 shots because the first one doesn't hurt, the second one's done, and then we're out the door. I always use reinforcement, especially when he did his first blood draw. I mean, I think I took him to the store and we did get whatever you want. But think about reinforcement, especially for any successful step they take. If they even just make it into the appointment and sit down in the chair and that's as far as they can get, that's great. You made it to that far. Because remember, it's about building that capacity to do a whole clinic visit at some point. And then I think the other thing too is realistic expectations. I don't push them past a point where it's not going to go well. I try to keep it in this, what I call the success zone. Are we successful now? Are we doing good now? That's great. Let's take it to that point. If it starts to go out of the success zone, that's where I'm like, we need to take a break. We need to maybe think about finishing this at another time. Next slide. So I think when I talk about supports for him, some of the things I've used in the past have been like first then schedules. First, we're going to wait, then we're going to go and sit in the clinic exam room. First, we're going to talk to the nurse, then we're going to see the doctor, those kinds of things. The other thing that I found really helpful with him, because he's such a visual kid, and then it might be helpful for you as well, is that watching videos has really been helpful. Getting braces on and off, great videos out there. One that I really liked is how to get a shot. And this was a really nice video, and we'll drop this in the resources for you as well. But then there's also social stories. So there's a lot of different things that you can use that can help support you through successful visits. And I'm going to have a list that's going to go with your resources today, so you'll have those. Next slide. So I think the takeaways again for both, right? So I think about from my perspective is, the parent taking Henry into the appointment, and from Henry's is that, really try to plan and prepare and communicate, what's going to happen. And the other part of that communication is also to let the clinic staff know what are the accommodations or supports that I might need while we're in that visit. Also be really prepared. Make sure that he's really comfortable. I've got all my information I want to talk about. We're ready to go. And then supports. Again, setting those realistic expectations to make sure that we stay in that success zone and we get as far as we can in appointments. All right, next slide. The other thing too is I just want to say we're always going to have resources for you. The resources are going to come out at the end of this. But here's a couple that are in here, and we'll drop them in now in case anybody needs them real quickly. And let's go to the next slide. I think we're into questions now.